Good afternoon, everyone. We are so happy to have you here. Welcome to our workplace well-being session for October. We're going to give everybody just a moment to get settled into the space, joined from the other places we're at. So just invite you to take a moment for yourself, take a nice deep breath, maybe grab a glass of water, and we will get started here in just a moment. While you are coming into the space, I love seeing these numbers go up. I just want to invite you in to think about World Mental Health Day is coming up, and we are here to talk about well-being and what that looks like in regards to how it can happen in our organizations. But I want you to just come into yourself for a minute and answer the question in the chat if you feel capable. And you're going to hear me repeat this, so I apologize. But what is one thing that can make you smile right now? When we talk about mental health is just as important as our physical health. And sometimes it's the one thing that we forget about. So in the chat, give us your name, maybe where you're at across the United States here today. I happen to be in Dayton, Ohio, and it's a beautiful sunny day. But also tell us one thing that you for certain know can make you smile. And please enter that in the chat as you come into the space. And we'll get started in a minute. And I see these coming in. Wonderful. So fun. Our family members, daughters, our dogs. Literally, we were just talking about the dogs. Um, Listening to rain, these are beautiful. So if you're just joining us, I see we have quite a few people. Come on, one more time in the chat as you settle yourself into the space with us and give yourself a moment to arrive before we get started. Share with us maybe your first name, where you're at across this beautiful country of ours, and one thing that for certain makes you smile as we talk about mental health and well-being. So what makes you smile? Where are you and who are you as we get started? And we have people from all over the place. I love this. Florida, Omaha, Washington, Pennsylvania, South Carolina. All right, we're touching all the coasts. Keep them coming. Love to see this. Okay. Hi, everyone. Welcome to Beyond Awareness, turning World Mental Health Day into year-round action. We are going to take an hour together to have some conversations with some individuals across industries about how mental health and well-being are talked about, structured, all the amazing things around it as we introduce World Mental Health Day in the month of October. So as you have settled in here, my name is Jennifer Cox. I am the manager of the National Trainer Network for Mental Health First Aid USA with the National Council of Mental Wellbeing, and I am delighted to have you all join us for the day. Now, first things first, many of you have found your chat box. Thank you. We love that you could find that and you're willing to share with us. Please continue to do that as we move through the conversation today. But if you have specific questions, and I really surely hope that you do, we do want to utilize the Q&A box. So if you're familiar with Zoom and wherever your toolbar is, either at the top or the bottom of your screen, find that Q&A box. That is the place where you can put specific questions into our panelists, to myself, to the mental health first aid team that's in the background to watch them, and know that you have the option to choose anonymous response or if you'd like it to come back directly to you. So that Q&A box is where you want to put your question specifically for us. The chat box is going to be where you're replying to right now, and if we do some different things across the time together for engagement. So that's just the simple way to share amongst each other. But the Q&A box is specifically so that we can get your questions to our panelists. There also is the option for you to do closed captioning. Sometimes it's easier to read or to see the transcript as it's happening. So find that as well. Up in your toolbar, it's going to be under the three little dots. And you can find that and click either live transcript or show subtitles and be able to see the communications in our conversation here visually, if that will help you. Now, if you have any technical problems at all for finding that, looking at it, please send a direct Zoom chat to, you'll see Mallory on the list of people participating, or you're welcome to send it to myself, to Jen, and we will do our very best to see if we can help you or find someone to help you with any technical issues. All right, so hopefully we have all settled in and are ready to move into this space. I'm so excited about this conversation here today. So first of all, World Mental Health Day. It is not today, but it is October 1st. It is the start of the autumn season, and the month of October is very special for us to be able to activate and bring just that much more awareness across our worlds, our workplaces, and even our neighborhoods. World Mental Health Day officially is celebrated on October 10th. every year, and it shines a spotlight on just the importance of mental well-being. And it's a moment, as I said, to raise awareness, to challenge stigma, to advocate for stronger policies and services that can support the mental health of every one of us. So this day also invites us to share inspiring stories, maybe some practical resources, and just that thread and that reminder of the hope that is out there. Because this reminds us all that mental health, as I said before, is just as vital as our conversations about our physical health. And we've gotten really comfortable with that over the years. But around the world, there are individuals and organizations that are coming together during the month of October and on the 10th to recognize this observance. We're doing it in different ways. There are events that are happening and campaigns and conversations, webinars like we're doing here to unite our actions together. So at the National Council for Mental Wellbeing, our theme for 2025 for the World Mental Health Day is actually One in Mind. And this is a reminder from us to our communities that mental well-being connects us all. It connects us across experience, across our geographic locations, and the roles that we play at work and at home. We believe that everyone deserves compassion, deserves support, and access to the tools that can really help them thrive. So our One in Mind campaign is here to emphasize the importance of breaking stigma, advocating for care, and standing together in solidarity for mental well-being. So we demonstrate our support by hosting webinars, by sharing stories, and providing resources that can help spark conversations and inspire action in the communities that we all live and work in. So how can you get involved? Well, you're here today. That's one of the first steps. So thank you for helping us to celebrate this progress, but thank you for also being a part of it and participating in the discussion, whether it's just absorbing the information, engaging with us in the chat, or giving us specific Q&As. We invite you to be a part of what's happening here today. So there's also a few other ways you can get involved. You see this QR code that's up here on the screen. This is a wonderful place for you to get more information, or even to get your organizations and people around you trained in mental health first aid, so that you know and can learn how to respond to someone facing a mental health or a substance use challenge or crisis. So please take action in that. And also, if you are part of this webinar today, we'll be emailing out to you, and you can get a connection to the flyer of 10 ways to take action for mental well-being. It will help you discover really simple ways to support mental well-being. And please feel free to share it with others once you get it. And we, of course, will be sharing it with you and anyone else who is registered for this session. So as our World Mental Health Day comes closer, and today opens the month up for us, we're here to open a conversation with the amazing guests that I have to share with you today, because we actually believe and support and put into every action that we do that mental health and well-being, it isn't just possible, it's promised. It's optimal for all of us, and it's accessible. So thank you for your participation in that, because we together and through this conversation today, we know we can make a difference. So I'd like to recognize and introduce you to, and they'll have a moment to introduce themselves as well, our panelists for the conversation today. First off, we have Brandon Batiste, who is the Vice President of Healthcare Innovation at Morgan Health. We have Dr. Les Certe, who is the Senior Consultant in Behavioral Health at Axiom Medical, and Kathy Muse, who is the Program Director nationally for the National Association of Counties. I've had the pleasure of working with each of these individuals, and I'm going to give them an opportunity just to say hello, introduce themselves, and then we'll jump into this conversation. So Brandon, do you mind starting us off?
Sure. Thank you for the invite. Great to meet everyone. Brandon Batiste here, Vice President for Morgan Health, a business unit within JP Morgan Chase. We focus on employer-sponsored healthcare, improving the affordability, quality, and equity of that care. Nice to meet you all.
Thanks, Brandon. How Dr. Certe?
Thanks. It's great to be here. I really appreciate the invitation. I am a clinical psychologist by training. I have recently just realized I have to say I've had over 50 years of clinical experience in some form or fashion. Spent the last 25 years mostly in corporate settings, consulting in behavioral health and helping to bring programs. And that's my role with Axiom Medical now, is as a consultant to helping bring mental health into the world of injury case management, which kind of bridges that gap between physical and mental health.
I love that. Thank you so much. And Kathy, how about you?
Well, thank you so much. Hi, everyone. I'm honored to join you today. I serve as the National Program Director for Public Promise Procurement at the National Association of Counties, or NACO, which is a membership organization representing America's 3,069 counties. And prior to this role, I spent 4 decades, which I'm also a little embarrassed to say, in public sector procurement, including as the Chief Procurement Officer for Fairfax County, Virginia. And that's where I was first introduced to NACO and to the mental health first aid program. For very personal reasons, I took the 2-day course and became a proud mental health first aider, and immediately was able to put that training to use in my own life. And it was a lifesaver for me and for my family. And so I became a champion for mental health first aid. And when I came to work at NACO, one of the perks is I sometimes get to help counties put into action this incredible training. So thank you so much for having me and including me in this conversation.
Well, thank you to all three of you, Kathy. And, we're only 10 minutes into this, and I've already got goosebumps from the inspiration that has happened here with the three of you. So I want to jump right into this conversation and really just start with, and Kathy, you kind of set us off there for a moment, but I'm going to say, how has each of your organizations, because you're all in very different industries, but how does your organization approach mental health? How do you approach your initiatives? And then in that conversation, you might be able to tell us, are there any barriers that have come in that conversation? And Dr. Curte, I'd like to start with you in that. So how
Thanks.
does your organization approach mental health?
Well, I think the general statement is, we've actually gotten used to hearing it now, but it's just the statement: mental health is health. You know,
Mm,
I have a really strong bias that we actually waste our time talking about mental health as different than physical health. It's because they all happen together.
yeah.
So both externally, that's how we approach it. That's how I always advise approaching it when I'm consulting with companies now. Um, Internally, I told this story briefly, and I everybody liked it, so I think I'll just tell it again. Um, we started at Axiom. We started to bring mental health in. We wanted to set up mental health first aid trainings for our staff, to help with each other and to help with clients who might call in. We set a reminder for a mental health check-in, just a quick online thing for our employees, and it was showed up as an appointment on the calendar. And I looked up at one point, and there were 150 people in a meeting, thinking that it was a meeting to talk about how we're doing in mental health. What that told me, that's such a huge percentage of the workforce at the time. It told me how hungry people are for paying attention to this. And so, you know, it, that became a part of a whole thing that we do inside of Axiom. But importantly, it underlines just how critical it is that we start paying attention.
Yeah.
So I'll start there. I could talk about barriers, but we'll see if anybody else wants to talk a little bit, and then I can come back.
Yeah, thank you. That reminder, so gentle. Brandon or Kathy, do you want to chime in regards to how your organization approaches mental health initiatives? And thank you so much, Dr. Curte, for that example. So interesting how that happens.
Yeah.
Go ahead, Kathy.
Well, NACO approaches mental health intentionally because it has been identified by our membership as an incredibly important issue. So we're addressing it constantly. In 2023, I believe, NACO launched a commission on mental health and well-being, which was a cross-sector initiative to reimagine mental health support through policy reform and innovations. And NACO partners with the National Council to bring mental health first aid at work to public agencies, which is a great way to engage the workforce. It also allowed us to respond to that outcry from our membership to address mental health in the workforce as well as in their communities.
Yeah, thanks, Kathy. And Brandon, you come from a different industry and experience in that regard. So tell us about how Morgan Health approaches mental health initiatives.
Yeah, sure. Well, organizationally, I would say that we're approaching it two different ways. One, through the firm, there's a really big focus on resilience, and then two, through comprehensive support. And so organizational resilience is a really big priority within the
Mhm.
firm. We know that resilient employees, focused on overall well-being are 60% less likely to suffer burnout and then 80% less likely to exhibit signs of depression. And so there's a really big intentional focus around resilience. The other piece to that is the comprehensive support. And so through our EAP, we have toolkits for managers and employees to access mental health toolkits. There's confidential counseling, crisis support, opportunity throughout the continuum, both
Mhm.
for local and I would say national resources. And then on the client side, we have a yearly Taste for Business 2000 Taste for Business Outlook survey that goes out to our business leaders. For 2024, there was a 65% of respondents on that survey identified mental health as a key priority for their business. And so we took that and partnered with Morgan Health, Chase for Business Knowledge Center, in creating actionable tools through a small and medium-sized business resource hub for organizations that are interested in healthcare coverage. And with that, there's a piece that is strategically focused on mental health well-being in the workplace. So those are the three major areas that I would say that we've been able to, that we're centering on mental health.
Thank you for that perspective and that look, Brandon, in regards to what you all are doing comprehensively. And I don't know about the rest of you all, but I hear a theme that there's more, number one, awareness happening. People are engaging in new ways. And some of it's been surprising, and others have been like, well, yeah, of course, right? So many of us have been like, where has this been all of our lives? And others are still hesitant. There's still that stigma there and having these conversations. And regardless of where we work, financial industry, right, community, county governments, medical field, schools. It's happening differently, but it's happening more and more. And most of us don't feel prepared to have that conversation, or we shy away from it. Now, I know in my privilege of being able to work with different organizations and industries, we've seen that leadership can play a big role in if this is adopted, how these conversations start. So, Kathy, if you could answer for me, especially in regards to how NACO has done this, but how do we ensure that mental health can be a part of leadership responsibility, right? Not just those of us that happen to feel comfortable in this space, but what is leadership's role? How's that look like for you all?
Well, as I said earlier, our membership insists on addressing mental health and mental well-being. So we leverage NACO's national platform to
Mhm.
spotlight stories of leadership in action, counties where mental health is embedded into operational planning, budget priorities, and in workforce development programs. And our publications, webinars, convenings, meetings, we showcase how leadership engagement drives cultural change and improves outcome across all kinds of public service delivery. We also advocate on Capitol Hill, so we're able to put our action where our mouth is, which most recently resulted not only in our advocacy, but successfully in the reauthorization of the Support Act, which is crucial to funding prevention, treatment, and recovery programs. So, when leaders prioritize training like mental health first aid in the workplace, when they share their own experiences, when they set mental health programs and legislation as a priority, it makes it a priority in those communities. And it shows that it's not peripheral, that it's
Yeah.
foundational to good governance.
Yeah, thanks, Kathy. Dr. Curtay, it's interesting when you said that you just sent out their reminders for your staff at Axiom to say, hey, mental health checkup, but then they log in thinking it's
Mhm.
going to be a community. What was the role of leadership and all that? Or was there any representation from leadership?
It very much so. I mean, it was really so. What I would add to what we're talking about here is that leadership has to be involved and they also have to be committed to driving it down through the organization because most of it is going to happen at the manager to employee level and among colleagues, right?
Yeah.
And that's the beauty of mental health first aid because it gives us the tool. Um, you know, what I have always loved about mental health first aid is we're really used to, you know, walking up to somebody or walking past somebody and saying, how you doing, right? And we expect fine. And if somebody doesn't say fine, if somebody says anything else, it's this moment of panic, like,
Yeah.
oh, now what do I do? Well, mental health first aid gives people the tools for that. So that happens at the ground level, but none of that is going to take place unless
Mm,
leaders not only say that they're invested in it, not only model it themselves, but also make it a part of the whole organization and driving it down.
yeah.
You know, it takes a commitment. You mentioned we're talking about it more. One
Mm,
of the things that I worry about is we're talking about it a lot more, but you know, how much are we doing
yeah.
about it? And that's where leadership plays a real role in making it happen. And
Yeah.
without that, we wouldn't have been able to do it. And without that, it wouldn't have been built into everything that the company does. Um, it's we have to have that kind of that level of commitment.
Yeah, thank you for that highlight. And it kind of leads me to think about Brandon with your organization and the role of leadership in these conversations, because you're at a different place with mental health first aid. Can you respond to that as well? As what is the role been or the responsibility of leadership?
Yeah, I think we're all saying that, mental health really should be a part of the business imperative, right? And, I think it's also probably apropos that we're having this conversation on the day that the government shut down, right? Like that's the elephant in the room. And so, it's really appropriate because, I think one of the major barriers that you really didn't get to is that I think there are resources that exist. There's mental health first aid training, there's tons of things that employers are offering through the EAP and other offerings. There's toolkits that employers can download and implement, but there really is a challenge with awareness, right? Which making sure that employees, managers are even aware of the resources that are available to them. And sometimes that takes repetition. I think for many of us, particularly those who have your annual wellness visit, you might get the SUH where, are you struggling with anything? Have you thought about suicide? That little checklist. But sometimes it takes a bit of time to develop trust. And I think that goes for with your provider, that goes for with your employer, that goes for with your manager, is that it's not a quick sort of thing. And so I think it really needs, from a leadership perspective, to be embedded into the culture and seen as a business imperative to the work that we do.
Yeah, thank you for that. And making it an imperative and part of the business, I think is really important, Brandon, for you to highlight for this, especially in the times that we're living in. I did have that, come across my heart today to think about the nature of what's happening in our world. Amongst the other things, just in recent events, the state of our world, there's catastrophes, there's emergencies, there are big things, and little things that are happening to our staff, to our coworkers, to our families, our communities across the United States right now, no matter where we work or where we live. So, World Mental Health Day this year, with our theme of that one mind and that connectedness, and the mentioning of resources that each one of you have mentioned in a different way. Brandon, I'm going to come back to you for this one, but because we've had these emergencies and these catastrophes happening, what do you think the biggest challenge is that you're seeing in ensuring that we have the support available to our workforces, but also accessible and equitable, right? That they're meeting the needs of what we're looking at. What's happening at Morgan Health with that, or what are your thoughts?
Yeah, I think part of it is that we don't really understand because we're not asking the question a lot of times. Many of us are not far removed from someone who has lost their job or is
Yeah.
going through something. And so it's sort of, while you may not be going through it personally, I feel like if you were a leader or a manager or employee, you sort of, once you get down to the brass tacks, you realize that we're all in this boat together.
Mm.
And so I do think there's the question about resources and people being aware of those resources. But then the question becomes, can you access those resources, right? Are we on the same playing field related to, one, our technology, two, the way that we engage, are the resources equitable in a way that I can get meaningful things, takeaways out of them? How easy is that resource to connect to other things like my physical health? You know, these are all questions that present opportunity, particularly when you think about scaling through a disaster, for example, where telehealth and resources and culturally competent connections are increasingly more important, right? And I think what we're seeing, you know, in some of the data that we've been able to highlight, particularly through our quality and outcomes report that's focused on employer-sponsored care, is that the mental health burden has continued to increase over time. And so that gap is continuing to widen. And so I think collectively there's opportunity through partnership, through alignment, and then also through communication related to what, you know, the needs of, you know, our collective either employers or employees to be able to close those gaps.
Yeah, thank you so much, Brandon. Dr. Kate, I saw you unmuted. Do you have more you'd like to share in this?
Well, that was actually me muting when I started to laugh about the timing of today's event. But I do have, for me, one of the real challenges in having equitable access to service is that we have to understand that mental health is not a monolith. Right? We have a tendency, when we think mental health, we have a tendency to think that means that somebody needs a therapist, that they have a psychiatric condition. But one of the things about mental health first aid is that we talk about mental health challenges, right? Which is a much bigger piece of the puzzle. And, you know, I always do this in live presentations, so I could do it if we were with an audience, you know, raise your hand if you haven't been stressed. You know, there's always one, by the way, there's always one smart aleck in the room who raises their hand, right? But a person who's stressed needs an environment in which they have access to coping skills, to ways to deal with it. They don't need therapy, right? And then if we took care of some of that in this end of the spectrum, in this you know, smaller piece of the spectrum, we'd have more access to the people who do need treatment. So I think that's a big part of it, is we have to change how we think about it. And I think that's one of the biggest barriers, is that we tend to think of things in a very simple, you know, we think of it like physical health, like you broke your arm, you get a cast, right?
Thanks. Yeah.
And you know, and so what do? We do things like we increase the number of EAP sessions without putting anything else in place, or raising participation rates, or we give people extra mental health days, right? Those aren't solutions. Those are tools, but it's not a solution to the big picture. And I think that's the biggest barrier, is we need to think about it in a bigger way.
Yeah, thank you for that. And thank you for bringing attention to that shift, right? Is we have an opportunity here. And we have always had, but now we're putting into the action this opportunity to look at this from a different way, not just what we can offer, but how, why, what's the goal for it, and where can it come from? Kathy, I know you have thoughts on this as well.
I do. And I love what he said, because I think it's a great opportunity to build local capacity. That first time contact with county staff or with a community member who's been through mental health first aid training is going to be more compassionate and understanding. So that first contact is a way to literally build capacity in your community for a sense of mental health and well-being, care, and concern. So like Dr. Curtis said, the person may just need direction to resources, may need that first contact to be compassionate and have a sense of caring. So I think that that's great. And through our partnership with Mental Health First Aid at Work, we're able to do that, build capacity among the workforce so they can not only, you know, realize and respond to mental health issues in the workplace, but in their families and then in their work with the community. So it's a great program to build
Yeah,
capacity.
And I think capacity, thank you both for highlighting that. It's about capacity. It's also about confidence of knowing like when that conversation does
Right.
start, what do I do? How do I say these things? How does this even happen? Versus, okay, I recognize it and then the fear comes up because most of us don't know how to have that conversation. And yeah, this training can definitely provide you with not only the language, but the tools and the confidence to be able to have that capacity to move into these spaces that it's just so needed for us to know that someone's out there and resources are available, but where do I start is the scariest sometimes step that we take. Thank you for that. As we think about that, and we know that World Mental Health Day is coming up, and I know each of your organizations do different things in regard to your initiatives, but October 10th is coming. It's 9 days away. How do you think we can maintain momentum beyond the 10th or beyond today's conversation, whether it's for you all or the people in the audience that are listening? And those of you that are with us, I want to ask you in the chat, is there anything happening at your school or your workplace or your neighborhood or your church for World Mental Health Day? And if it is, throw it in the chat. Be like, oh yeah, we're having a fundraiser or a festival or a campaign or whatever. But tell us in the chat what's happening there. But I'm also going to talk, let Brandon, can you tell us about what might be happening? How do you plan to keep the momentum going and having these conversations happen after October 10th?
Well, I think it's taking it away from just the day, right? I think it's really great that we have these months and these weeks and these days where we really celebrate mental health, and there's always a lot of momentum and really good engagement. But I think that the challenge is keeping that momentum, going forward. And I think part of the opportunity is to think about mental health, in terms of prevention, in terms of ways that we can continue to ask the question related to wellness, integrating into themes such as resilience, connecting to other partners and collaborators, where for employers or organizations who are thinking about closing some of those gaps. Those are some of the ways that I think would be great to carry the message forward outside of, the day itself. Some of the things on our end, obviously, business resource groups are important in being able to not only share the message, but share the message in a way that could be translatable both culturally and based on, member demographics. Policy integration is also really important in carrying, mental health, putting that into standard operating procedures if you're in an organization that's thinking about this work. And just keeping the conversations going. I would say just the year-round check-in, whether that's through education or through events or through a campaign, regular check-ins with your staff and incorporating some of these discussions into team meetings, I think is very important. And even peer support networks, as well. So all these things are ways that we can keep the conversation going outside of this wonderful day that we'll celebrate next week.
Yeah, thank you, Brandon. And I love that you gave kind of the full spectrum of where these conversations can happen and those check-ins can happen. And I even saw in the chat someone saying just reaching out with a Teams message, right? Or a Slack channel, or however you communicate in this virtual world, a text message, a knock on the door, just one-to-one, human to human, coworker to coworker, to be able to say, hey, how are you today? How are things going? And by the way, here's things that could support you. Dr.
And
Kurte,
can I just add,
Sure.
and I was going to add real quickly, going back to one of the things that Dr. Kirtley said earlier, is that, these things also take time, and so, giving yourself and your organization the grace to be able to say, this might require more than one conversation, this might require more than one check-in, we sort of have to build the trust. And so just acknowledging that it is a process and requires some time.
Love that. Thank you, Brandon. Such a great reminder. Dr. Kurte, thoughts?
Yeah, well, I mean, first off, it not only might require another conversation, it will. It requires conversation all the time. The thing that came to mind for me with this question is, you saw the same thing in the chat that I did, that, just talking to people and asking people. Even at the very beginning, you asked that question, right? As people were joining, like, what is one thing that makes you smile? And I immediately started to smile. And what I realized is that what made me smile is somebody asked me that question. This is really about building a culture. People have heard, people who know me have heard me say all the time, The four most powerful words in the English language are "How are you doing?" And notice that it's four words, not three. It's not "How you doing?" It's "How are you doing?" as if you actually want to know the answer.
Yeah.
And creating a culture in which that happens on a regular basis. And yes, I get it. A lot of us are remote, but you know what? A Teams message works too. A
Mhm.
phone call works too. It is really building that into the culture that will make this survive. One more quick thing, if I may. Um, you know, we had a there was a big movement for a while about, it's okay not to be okay.
Hmm.
And the problem was that it wasn't true. The problem was that when we actually looked at the research, managers were still punitive by and large with people who expressed a mental health challenge at work.
Yeah.
And that continues, and that's because we've tried to throw band-aids at it instead of building a culture that really helps support everyone in the workplace.
Yeah.
And that can be done, but as Brandon said, it takes time. It doesn't
It
happen
does.
overnight.
It does. And it is such a process that every little step is going to build in that positive direction
Mhm.
towards what is possible. And we each have a power to be a part of that for sure. Sometimes it can be as simple, hi, how are you doing? And waiting for the answer, like you mentioned, Dr. Harte. But it's also about connections. It's about those partnerships. It's about who do we link arms with? Who do we hold hands with to take this journey together? And I know each of you and your organizations as well have done that. Kathy, can you tell us a little bit about partnerships or where you've reached out? What agencies have you connected with to amplify these efforts that you all are doing across the counties that are part of your alliance there or association? What have you done in regards to partnering?
Actually, I'm going to reach back to a really cool example from Fairfax County, which
Okay.
is where the Board of Supervisors had made and continues to make mental health and well-being a priority for both staff and residents. And when mental health was first introduced in the US, it was the Fairfax was an early adopter. The Community Services Board implemented the 2-day training for case managers and frontline service providers. And the partners with the community-based organizations that deliver these same similar kind of services are part of the safety net in Fairfax. So through what's called the Consolidated Community Funding Pool, the county awards grants to these organizations, and they're outcome based, and they have expectation to provide these vital services. So, seeing the importance and the effects of mental health first aid, they extended this training to those volunteers and staff in those organizations, and then onward to clients and client families involved in the ASAP program, and then and onward. I mean, it just proliferated. So it clearly created that culture that we're all talking about. So and that was through the Health and Human Service agencies. I was in procurement and was lucky enough to be able to be exposed to that training and then became a champion for it. And what made it effective really was the leadership buy-in, the sustained investment, so that it's not free, but there is train the trainer model. So I mean, there is a way to make this institutionalize this at a very, very low cost. And so they didn't just fund the services, they created this culture that we've all been talking about. And hopefully it continues today. I'm sure it does, and that it's impactful both
Yeah.
among the staff and then among the clients that are served through the programs.
Yeah, thank you, Kathy. And thank you for highlighting Fairfax County. I know I was honored to be a part of those first deliveries when we were having those initial conversations. And the questions that came up and the I think the gratitude, I think, is some of the word for saying, oh, finally there's something, right? So something to be able to help us to move forward and to shift that culture as we talk about it's a journey. Thank you, Brandon, for that reminder of the process and what we move through and how do we make the shift in our own perspective to make sure we're doing this for the right reasons, not just the ROI that we all look for, but what's the human elements and how can we move this forward? and making people instructors so we can carry this out, not just first aiders. And we'll talk about that at the end of this today. But thank you for highlighting the value and connection. I don't know, Brandon or Dr. Curte, if you want to answer that as well, but any partnerships that you found that have been helpful for this culture shift in these conversations? That's okay.
Seems like we should come up with something, instead of
Well, Kathy did a
being
pretty good job, but
Kathy did a great job. Well, I think in a very global way, it's also recognizing that we're not in it alone, and that partnering with, if you have an EAP, then actually partner with your EAP and don't make it a throwaway benefit. If you work with a carrier, with a health carrier who provides behavioral health services, then work with them to actually provide the things that your workplace needs, right? It's so organizationally, there are pieces that I've thought a lot about, but there's also this, okay, we have resources, but they're only as good as the utilization rate.
right, right.
And so I think that becomes the primary partnership in my mind, for employers.
Yeah, I love that. Thank you so much. With that in mind, we have actions to take. We've all talked so much about the value of the culture change and the unique ways and the perspectives that you've all given. But it takes action. It's not just, oh, this would be a nice thing. What role we each can play is also a huge element to all of this. So, Brandon, I want to start with you and see if there's one action that you could suggest today to the people that are a part of this webinar with us here, that whether it's October 1st or after October 10th or every moment of breath that we have, what's one action that you would suggest that can possibly ensure a lasting impact or accelerate or even activate this within our culture and our communities?
Sure. I couldn't give just one, so I'll give two, right?
Okay.
So the first of which is around measurement, right? You can't track what you aren't measuring. So I feel like measurement is very important. It's also a challenge. We can have a circular conversation about it because it's also very difficult in this space, often to articulate, measure ROI, just because the numerous provider types, and also the resources and how mental health is a really core function of a lot of the different things that we do from a healthcare perspective. But regardless, it's still important to measure and track where you can. The other thing that I would add is that it's also important to adjust accordingly, right? So today's problems are not tomorrow's problems, as we've seen, right? And so, today's issues are not going to be tomorrow's issues. And so I think it's really important to revise your measurement, look at, do the pulse checks through surveys and see how the opportunity for your employers, for your members, for your organizations continue to evolve, so that you could help to close those gaps over time and making sure that, there's coverage. But those are
Yeah.
the two that I would prioritize.
I love that. Thank you for your 2 actions for the suggestion. Kathy, what are your thoughts? What would you say is the one action you'd suggest for people listening? And then we'll get to some questions, and I have a few to answer in regards to mental health first aid specifically. What are your thoughts, Kathy?
I agree. I would work on institutionalizing programs that build capacity within your workforce and then proliferate them out into the community. So, scaling mental health first aid at work, from leadership or down, or from frontline service up, however, whatever you think works best in your organization. And then, as Brandon said, measuring impact through workforce and community outcomes, I think is really important, and will also support future investment in the same kind of program. And then I would suggest that people make it part of their workforce onboarding, so that mental health first aid becomes part of what you do when you start the job.
Yeah, thank you, Kathy. Dr. Carte, your thoughts?
I also have two. I'm sorry, I can't break it down to one, but one actually was triggered by what you were saying, that, this is it's so ingrained in anybody who's been in business for a long time that, it's like you can't manage what you can't measure. Unfortunately, the things that are really important to manage are really hard to measure. And I think one of the things that I would say, the one thing I would say at the leadership level is stop thinking about it as ROI and start thinking about it as an investment in your people, right? Because we keep thinking about, we have to prove the case. It's like that, it shouldn't be that hard, really. And then on the other end, at the ground level, what I would say is incorporate a questionnaire about psychological safety into your pulse checks.
Mm.
Because that's the question that's important. Do your people feel safe to raise not just issues about themselves, but to disagree, to make suggestions about innovations, right? That's what psychological safety is. It's not just about feeling good. It's about feeling like you can put yourself out there and show up as yourself. And it's really simple. It's 7 questions, and it's very informative um, to make a difference. So I would say, one is an attitude change at senior leadership level. The other is what do you measure in addition to ROI, which is, in my mind, is psychological safety.
Yeah, thank you for that. Such an important thing to highlight. And how do we get into this, and how do we how do we move this in a way that's going to feel appropriate for the community that we're looking at, whether it's our workplace or a broader lens? I'm going to shift us for a moment, and we're going to come back to, there's quite a few questions from the audience that we want to make sure we have time to answer. But one of them in there specifically asked, y'all have talked about mental health first aid training. Is this just for professionals? And I love that you asked the question, because it's actually designed, mental health first aid is designed for humans. It's actually intended for people that do not have any kind of medical or therapeutic background. And that is the beauty of it. This is not mental health first aid talking, but I think it just helps us be better humans across the board. And it's an opportunity for us to build skills, have the awareness, and to practice in a really safe environment, as has been mentioned here a couple times, the skills that we're learning. So I want to just give us a little bit of insight into that and some opportunities. And then we're going to come back to the audience questions. I'm going to give the panelists the time to look at them. Mental health first aid is an evidence-based program. It has been in the United States since 2008, and it teaches us the opportunity, or gives us the time, to learn the skills of how to identify signs and symptoms of mental health challenge in humans, adults, youth, workplace, what have you. And then it helps us understand what might be happening, whether it's a non-crisis situation or in a crisis situation, how to identify those for safety. And then how do we respond once we see all this? How can we be responsive instead of reactive to the humans that are in front of us? And the program teaches this 5-step action plan. It's called Algae. And no, it's not the stuff in your pond in your backyard. But it teaches a 5-step action plan to say, okay, you noticed. Now, what do you do with this? What is our best practice? And it gives us a little bit of a way to say, hey, have I done all that I can to help this individual to get from this moment of challenge or crisis or uncertainty or safety to move into that which will help them, whatever that recovery process looks like. And recovery is possible for all of us, but we become that bridge. We're the noticers to identify, understand, and respond. And we are the bridge to get someone to the benefits, the resources, the whatever it is that can help them to find a healthier, more balanced well-being, comprehensive well-being for themselves. There's lots of different ways to do that, as you see obviously here on the screen. Many of us don't know how to help. We don't know what to do when a friend or a coworker or a loved one is in crisis. We might be leaders in our organizations, and maybe we're just looking that we want to improve morale. We want to give our people skills and help them know that, yeah, we care about you, and let's care about each other as a collective. Maybe you're a high school administrator and you want to find a way to help students grow and support each other. That's a team program, right? But we have training opportunities available for you. There's instructor training in organizations. Kathy mentioned about not just doing a first aider training, say, hey, here's the idea, but to equip teams of people within your organization that can deliver these trainings and start these and guide these conversations as mental health first aid instructors, that then generates a continual network of support and helps sustain the culture that each one of our panelists have talked about. If you're in schools and you're wanting to equip teens, young people, how to help young people, we have a teen program that teaches youth the skills, these action plans, and how to do that in a way that feels comfortable for them and to find those trusted adults within their schools or their learning environments. And we also have mental health first aid at work that has been talked about, and some of us use here that is specifically for our industries, our corporate culture across, whether it's energy or finance or entertainment or sports, that we help deliver and help our employees learn how to help each other in the different stressors that a work environment creates for us, and then knowing the resources and how to help. So there's lots of ways that you can be a part of mental health first aid. And some of us, sit in a training as a first aider. I'm one of those as a therapist. And then it's like, I need to teach this. How can I be a part of it? Because I want to be the voice to help these conversations happen in a structured, non-stigmatizing, and empowering way. So there's lots of ways to do that, and that's what we're here to help you do. So in a moment, I'll take this down, but I just want to leave this up. If you're like, oh gosh, I want to know more about that, tell me about adult or tell me about at work. These QR codes on your screen, they'll come back up here again. But take a picture of them with your phone right now while they're on your screen, and it's going to directly connect you to resources and support here at the National Council. And again, I'll show these at the end, but I want to get to a few questions as well. Now that we know what the mental health first aid is as a first aider, how it can help, how we can maybe be a part of it, but then you all have some really, really great questions that I want to give our panelists the time to talk about. So let's look at the first one here. One of our attendees says, why do we think there's a gap between the importance we give to physical health and the attention we give to mental health? Where's that separation or that gap happen? And what are the barriers for us as a community or culture or humans to keeps us from them being seen as equal? I know, Dr. Curtay, you have a opinion about this as well as myself, but what do you think the barrier is that keeps this separated?
There's a lot. I mean, part of it is simply the stigma of, nobody thinks twice if I break my arm. I used that example before. Everybody thinks twice if if I describe depressive disorder, right?
Mhm.
If I have really significant symptoms, it's partly because there isn't an external sign. You can't see it. And so it's hard to believe. And there remains stigma about that. And both about providing and getting help. A corollary to that on a systems level is that because it's hard to nail down, we're afraid that it's going to be a bottomless pit. We're afraid that if we start to provide mental health support, that it's going to be this endless stream of cost. When
Yeah.
in fact, we have definitive evidence that in settings in which adequate mental health is provided, healthcare costs go down. Total cost of healthcare goes down when you provide adequate mental health care. That's
Yep.
rarely talked about, right?
Yeah.
And yes, they're squishy numbers. It's hard to measure. Nevertheless, we have very good evidence for it. And so, but part of it is still that we don't believe that,
Mm-hmm.
right? I say
Yep.
this stuff and people look at me like, like my dog does when
Really?
I've done something weird, right? Um,
The head tilt.
yeah, the head tilt, exactly. But I think that's really is part of it. And we need to do a better job of telling that story
Mm.
so that we allay some of that fear and let people sort of begin to bring this into their culture more.
Thank you. Thanks. Such a thoughtful answer, and hopefully to whoever put that in the chat, that we gave you what you were looking for. But that also leads us into, we're all in specific industries. We all work in different spaces, and one of our participants asked, how do you do this? How do you foster mental health when we're virtual, when we're global, and we have all these cultures and technology and teams and country-specific things that are happening? How do you do that? How do we have these conversations, or how do we foster this? And I know many of you are global, and look at the outreach that is there. But does anyone have any thoughts of our panelists of how have you seen success, or what have you done to attend to this? We're not sitting in desks next to each other and walking down the hallway together anymore. Have you had to address this, and what have you done?
I'll take a first shot at it. That it really the question actually posed the answer, which is that you have to build a team to
Mm,
really assess what's needed where, right? If you're global in particular, because different countries are going to have different needs, different kind of a mental health resource, a mental health program on an oil rig in rural Texas is going to look different than a mental health program in a call center.
yeah.
And you have to do that, and it takes a team of people to help you build it. In
Mm,
terms of being virtual, I actually think that's less of a barrier than we think it is. Because reaching out to somebody on a video call or by email or by phone call is every bit as effective as having a conversation with them if you're having a genuine conversation.
yeah.
So I think we're making too much of that part of this, that it is possible to but you have to do it on purpose. You
Deliberate.
can't just pretend that it's going to happen on its own.
Yeah. Thank you for
Um,
that. Thank you. I saw Brandon shaking his head. Brandon, I know you have some thoughts in this regard.
No, yeah, I was going to say that, it's important to just understand, the specific needs of, the population that you're interested in. Like one area of specialty that has continued to increase with virtual care options is behavioral health. All other specialties have been on the downward trend following the public health emergency, COVID, right? So there is a space, but the way that we all receive information, but also the way that we like to receive care varies. Some prefer the brick and mortar space, some prefer the virtual
Mhm.
options. You think about employers like Delta, where their employee base are always in the air, right? So a virtual option might be more accommodating, right? Versus retail. And also there's so many different options that I think are available to people nowadays. And the question is, how do we sort of leverage the ecosystem to sort of close those gaps?
Thank you for that. So important. And thinking about that as we wrap up our time here together, first of all, thank you so much to each of you for your insights, for your ideas, and your willingness to step out and share what your organizations have done and are doing for each of us to maybe learn from. I want to give a little bit of information back to the team or to our observers and also remind just that we all play a role in this. In our own well-being. Someone asked about self-care and how it can be a band-aid and how we sometimes talk about that. But the biggest way to help is something that Brandon said at the start was about prevention. How do we do this? How do we create this now so that we can combat or decrease the opportunity for the things to happen down the road? Prevention is huge here, and that's a part of self-care for our community and our culture. It's also about taking the time to cultivate and be a part of the journey, however long it takes to incorporate these conversations in your workplace. And the literal first sentence that Dr. Curte said when we started the conversation was that mental health is health. It's not just what's happening in our brain or in our bodies. It's about the whole person, how they're showing up to the workplace, how they show up at the soccer field or the church or the neighbors or your living room. It's really about all of us and how we show up, and just to give ourselves those reminders to take the time to be willing to be a part of the conversation, to model and to cultivate and grow this across time with each other. So it's super important, and it's helping us to create this reality that at the National Council we really and truly believe in, and it guides all that we do. So at the end of our time here today, again, I want to show these QR codes to anyone. If you're curious, you want some of the takeaways that we've talked about here today, these codes are there for you. We have staff. It's what we do here. If you're curious about what would this look like in my organization, or how do I get trained as a first aider, any question in regards to how we can support you, or if we didn't get to answer your question in the Q&A, that we can come back to. Maybe it'll help you in that regard. We also have another resource I want to make sure that you have access to as well, is our World Mental Health, the 10 ways, the action steps that you can take to foster these conversations today through October 10th and every day 365 across the year. The National Council, we put these things together for you, to help you, to motivate you, and to bring us into a greater sense of community and health, to be very honest. A huge, huge thank you to our panelists. Thank you, Dr. Hurte. Thank you, Brandon. And thank you, Kathy, for not only what you did here with us today, but honestly, your continued efforts up until this point over the years, and all the amazing things that you have on deck, and to explore and expand within each of your respective communities. My deepest gratitude from me as a human, but also from the National Council on Mental Health First Aid USA. We look for the checklist. It's going to be sent to you via email. This recording is going to be available for all of you and for anyone who didn't get to show and be a part of the conversation today. But if you registered, you're going to get this as well. So thank you all. Please do take good care of yourselves as we transition into the seasons, but also as we transition in this world of sometimes uncertainty that we're navigating and the stressors that are there. So please, as you leave our time here today, take the survey at the end, give us some feedback, let us know what else you want to know, or if there's any information that we can provide to you. Okay, we're here, we support you, we're grateful for you for taking the time for this conversation today. And again, to our panelists, thank you for your participation. You are doing wonderful things, and it's so nice to be able to highlight that and for you to share your insights. So thanks, everybody.
Thanks. Thanks, everyone.